So my name is Angelina Itagle. I am a second year nursing student at Fundal Massage College, Manila. So today I'm gonna show you how to do a fundal massage.
Fundal massage, also known as uterine massage, is a technique used to encourage the uterus to contract properly after delivery of the placenta.
These are the things that you need to do for the assessment.
Assess the woman with factors that predispose to poor uterine tone or inability of her uterus to maintain a contracted state, such as conditions that increase for postpartum hemorrhages. Obtain the mother's blood pressure and heart rate. Blood pressure drops abruptly due to vaginal bleeding. Check for loss of blood that leads to hypovolemic shock, such as falling blood pressure, a rapid weak or thready pulse, increased and shallow respirations, pale, clammy skin, and increasing anxiety. Estimate the amount of blood by counting number of perineal pads saturated in given lengths of time, such as half-hour intervals. A rough estimate of the amount of blood loss can be formed.
Now, let's go to the planning. Explain the necessity of the procedure and provide privacy. Next, position the woman on her side when inspecting for blood loss to be certain a large amount of blood is not pooling undetected beneath her. Palpate a woman's fundus at a frequent intervals to be assured her uterus is remaining contracted. Now, let's implement the procedures from assessment and planning. Good day, ma'am. I am Nurse Ange. I will be your nurse for the day, and I will render a fundal massage to control vaginal bleeding and encourage uterine contraction.
Explaining the necessity for the procedure and providing privacy helps to decrease anxiety, and providing privacy enhances self-esteem.
Before we begin, ma'am, I would like to assist you to void or urinate to lessen the pressure and to avoid discomfort.
Ask the patient to void unless bleeding is extensive and more rapid actions seems necessary. An empty bladder prevents displacement of the uterus and ensures accurate assessment of uterine tone.
Ma'am, may I assist you to lie on the bed with your knee flex?
Proper positioning enhances visualization and effectiveness of procedure.
Ma'am, I'm gonna start to massage your fundus by placing my one hand on your abdomen, just above the symphysis pubis, while my other hand is in the top of your fundus.
Proper placing of the hands anchors the lower uterine segment and allows you to locate and assess the fundus. Ma'am, I am now rotating my upper hand to carefully massage your uterus in order to encourage uterine contraction. Rotate the upper hand to massage the uterus until it is firm, being careful not to over-massage. Massage should be done only when the uterus is not firm, and aggressive massage may lead to a partial or complete uterine prolapse. I can now feel that the uterus is firm. I will now press her fundus between my hands with slight downward pressure against my lower hand. Gently squeezing with downward pressure helps to expel blood or clots collected in the uterine cavity. Ma'am, please allow me to check your perineum in order to remove the passage of clots and estimate the amount of your vaginal bleeding. Asking for patient's consent is the discomfort. Observing the woman's perineum will allow you to remove the passage of clots and estimate the amount of vaginal bleeding. Ma'am, we are almost done. I will do a fundal massage one more time just to make sure that your uterus is firm.
Ma'am, I'm now gonna start to clean your perineum and have replaced you a clean perineal pad.
This helps to promote comfort and hygiene while reducing the risk for infection. Discard gloves and soiled pads according to agency policy.
Now that we're done with the assessment, planning, and implementation, let us now go to the documentation. You need to remember 3 things. First, document the results of the procedure. Second, continue to assess the fundus and lotria according to agency policy. And third, notify the primary care provider if the uterus does not remain firm or if the bleeding continues. That's all for today, guys. Thank you so much for watching, and I hope you have learned something. Bye-bye!